Duns, beautiful people. Good morning, good afternoon, good evening, wherever you are in the world. Welcome back to Duns, beautiful people. I am Dun Stedler, and thank you for sharing your moment with me. I'm super excited about this hospice video. Welcome to all my new supporters. Also, big welcome to you guys. I'm so super excited every time I see that I have a new subscriber. I'm so happy because this is, you know, a small YouTube channel, but I believe with the grace of my Lord Jesus, we're going to grow. That being said, guys, let me know. So I have my scrub top on, as you can see. I don't know if when I'm doing my hospice videos, if I should wear my scrub top on, if I should keep my scrub top on or just have regular clothes. Let me know. I'm not sure yet what I want to do. Just like when I do my natural hair videos, as you guys know, I have my natural hair on. So a little background info for those of you who doesn't really know me or this channel. This channel is about three things, okay? I couldn't make up my mind because I am passionate about many things, but I chose to focus on three things, okay? So this channel is about relationships, it's about natural hair, and it's also about hospice care. Okay, as you probably has already guessed it, I am a hospice registered nurse. Okay, I've been a nurse since 2010, of which I've been doing hospice care since 2012. Okay, so tonight we're going to be talking about hospice, why now versus later. Okay, why is it a better idea? Why is it a better decision for you to start your loved ones on hospice care now versus having to wait till later? Okay, so for those of you who are not too familiar with what hospice care is, please view my other videos. I'm gonna try to put a link in the description box so that you can kind of get familiar what hospice is. Basically, hospice means that your doctors say you have about 6 months or less to live. You have a terminal diagnosis where there's no treatment, no cure for it. But that doesn't mean you're going to die right away. Hospice does not mean you're gonna die tonight. So me doing these videos, I just want to bring awareness. I just want to bring a bit of peace of mind to caregivers and to the patients. When they hear the word hospice, they're not too worried or they don't know what to do. So I just want to educate and bring awareness to the public to just let you guys know that because there's help out there, there's support, there's a lot of resources that hospice provide. And also, that being said, please be on the lookout for my book. Yes, I am basically done writing my very first book, and it's about end of life care. It's about hospice. The title of the book is going to be End of Life is Life. Yes, because the moment we are born, we're dying. So end of life is life. So it's coming. Let's see, we are in January now. Look out for it by the end of February or early March. So, but I will keep you posted on when it's coming out. I'm super excited. Woo! So that being said, let's jump to the video. Okay, let's talk about hospice, why now versus later, which is what the topic is. Hospice now versus later. Too often, what I've witnessed in my career, and also if you talk to other nurses, other hospice nurses, they will let you know that family members, caregivers, even sometimes even the doctors themselves, they usually wait till the very last minute to refer the patient to hospice. And then usually what happens is that I've had situations where while I'm in the middle of admitting a patient, that patient passed. Or, I would admit a patient under hospice care, and within 2 to 3 days, the patient would pass. So that's really unfortunate because the patient did not get a chance to reap all the benefits that hospice has to offer. And if you guys want to learn more about those benefits, I'm going to also put a link in my other this other video that I made. And just so that you know, I have a playlist of just hospice videos. So if you are really interested, and if you'd like to learn more, if you have a loved one who's about to go under hospice, or if you know anybody, you know, if you're just curious about the topic, I really encourage to go through the playlist. So like I was saying, when we wait too long, the patient does not get a chance to reap all the benefits that hospice has to provide. And so everything's sort of like rushed, you know. There's no time to build a plan of care. There's no time to build relationships. Sometimes too, it's very difficult for the hospice team to manage the person's symptoms. You know, because everything, like I said, there's not time, and everything's really rushed. And the best thing to do is to get under hospice care as soon as possible, okay? As soon as your doctors say that, okay, we've exhausted everything, and there's nothing more medically we can do, it's the best time to call hospice. Okay, now let me give you some examples so that I can make myself more clear, so that I can have you understand more. So, okay, for example, if you have, say you have your 80-something-year-old mother, so you have your 83-year-old mom, okay, and I also give this example in my book. If your 83-year-old mom, if she, you know, has Alzheimer's, dementia, she is prone to falls, she's incontinent of bowels and bladder, she has a wound in her buttocks, her coccyx, you know, she's not really eating, her appetite is poor, she's pocketing food, and she also has frequent UTIs, okay? Now, for those of you who are familiar with what Alzheimer's dementia is, it's a disease where there's no cure for it, where every year the person will get worse and worse, okay? Now, especially nowadays in this time we are in, you know, if you don't want to keep on taking your loved ones to the hospital, because each time you take mom to the hospital, mom become more anxious, more agitated, okay? And then if and when mom would be hospitalized, you know, she's at risk of being more confused and even possibly contract pneumonia, you know. Hospital, from the hospital, is called hospital acquired pneumonia. Now, if you were to call hospice at this point, okay, I'm going to list the benefits that hospice could help with. First of all, regarding mom's wound, mom's coccyx, okay, we can come into the house and help to treat her wounds, okay? We could help to treat her pressure ulcer. The hospice nurses can come to the house as many times as is required, you know, as often as is required. Sometimes it might be twice a week, sometimes it might be 3 times a week, or it might even be 5 times a week. In some instances, the hospice nurses can be in the home, you know, five days a week, to treat the pressure ulcer so that it doesn't get too big, you know, so that a stage 2 don't turn into a stage 4, or, you know, or worse, you know. So that's one thing that's one benefit of hospice. And regarding the UTI, regarding frequent UTI, the hospice nurse can come into your house, obtain a urine sample right then and there, okay? She will then bring it to the lab, and then the lab will, you know, let her know whether or not you have a UTI, and then she will collaborate with the hospice doctor, with the hospice medical director, to get mom the best antibiotics that will be available to her, so that, you know, the UTI can be dealt with. And then best of all, you as the caregiver don't even have to leave your house, because the hospice they deal with pharmacy, so that the pharmacy person will deliver the antibiotic straight to your door. So that's a huge benefit right there. Just think about it. That's a huge benefit. Sorry about that, guys. So that's a huge benefit. Whereas, that saves you and mom a trip to the hospital, rather than having to get mom ready, fussing, getting her into the car. Most often mom might not even be able to walk, so trying to get transportation to take her to the hospital, or call 911 to take her to the hospital. When she gets to the hospital, that's another risk right there. She's more disoriented. All of these lights, all of these people coming at mom, they don't know mom's baseline, they're not familiar with mom, waiting to try to get a sample on her. The whole thing can be really traumatic for a 80-something-year-old patient with Alzheimer's dementia. Whereas, like I said, the hospice nurse can take care of all that in the house. We can take care of her wounds so that her wounds will not exceed, so that she might not be infected, so that she can have good skin integrity. And then we'll also do teaching with you, and also we'll help with the UTI. So those are, as you can see right then and there, if you were to wait too long, mom would not be able to reap those benefits. Okay, do you see what I mean? So the sooner you put somebody under hospice care, the more comfortable their life will be. It's a matter of focusing on quality of life. Okay, it's quality of life versus quantity. Another example I would like to share is, say your father has metastatic lung cancer, okay, which has traveled to the bones. Now, nowadays, and I'm sure you guys are familiar, doctors are reluctant to prescribe opioids, okay, because of what's going on out there. Doctors are very conservative when it comes to prescribing opioids. Now, with the example of dad having metastatic, cancer to the bones, that's painful. Okay, if you know somebody with that diagnosis, if you've cared for somebody, you'll know that's a painful. Oftentimes, these patients will experience pain. Now, with hospice, rather a benefit of putting, somebody, your loved ones with metastatic cancer to the bones onto hospice now versus waiting for later, is that we can well manage the pain. When you're under hospice care, the doctors, they are well versed regarding pain. They are not going to say, oh, I'm not going to prescribe this or that. When you say you're in pain, we will manage that pain. Okay, we will give you the right medication that you need, whether it's morphine, Dilaudid, oxycodone, fentanyl patch. Okay, there's a variety of medications we can prescribe. Whereas I have gone into homes where the patient is only on Tylenol. They're only probably on Percocet, just like something that's very mild, and then they're telling me, Dawn, my pain is still an 8 out of a 10, and I have to take this medication, on the dot every 2 hours or every 3 hours, and still I'm not able to sleep at night. The pain wakes me up. And, that's really hurtful to hear, So if you have a loved one, and then, like I said, these doctors, the primary physicians, they don't want to give, opioids, pain meds, which I understand, with everything that's going on. But if you're under hospice, that's one less thing you'd have to worry about. Because if you say, if if we see that, okay, you're taking say you have OxyContin, okay, twice a day, every 12 hours. Say you're taking it twice a day, and then in between you're still requiring to take PRN meds, okay, in between breakthrough meds, we can increase the dose right away. It's not going to be a problem, because the focus when you're on hospice care, it's quality of life versus quantity. We manage your symptoms, okay? So it's a great thing to have, your loved ones right now under it versus to having to wait. So imagine somebody like that, spending weeks and months in agony, just, in pain, because a doctor is afraid to prescribe meds. You see what I mean? So there's a lot more with it, but I just wanted to kind of share, just give you guys a little bit introduction, just a little, and I'll be making more videos about hospice, of course, but I just wanted to kind of open your eyes a little bit, just to start a conversation why it would be beneficial to your loved ones, and also to to start now versus later, because from my experience, caregivers who started their loved ones on hospice sooner, they have great things to say. They've built a relationship with the team. There's a plan of care. The patient has equipment delivered to the house, medication. It's just, a very comfortable and smooth transition. We help with get you ready for funeral services. Like I said, the moment we are born, we are dying. And so part of life, end of life is life. Like I said, the name of my book, End of Life is Life. So part of life is, the process of dying. And hospice care helps you to pass in a respectable, dignifying way, okay, that is comfortable to you and your loved ones, okay? We are not here to take over, by no means. We're here to make sure that you are comfortable, you are a priority, you're not suffering, you're not in any pain, okay? And we understand that it's a very challenging, tough time in your life. And we're just here to try to make it a little bit easier for the loved ones, for you. All right. So let me know what you thought about the video. Let me know if you have any questions. Okay. As always, I love you with the love of Jesus Christ. Be good to each other. Take care. And please, if you enjoy this video, please subscribe to my YouTube channel, like and share, and I'll see you next time. Dunsbeautiful people. Thank you.